Good morning. Today's class is about interdental cleansing aids. So I think you all of you are familiar about the requirement of mechanical cleansing aids in maintaining oral hygiene. So why do we need cleansing aids specifically for the interdental areas? Look at this picture. You can see lot of deposits, not just on the facial surface, but even on the interdental surfaces. And periodontal disease, as we know, it originates from the interdental area. This is mainly because this region is difficult to maintain. Apart from that, the interdental papilla is rich in blood supply. So it can identify and it can detect even minor amount of irritation, and it can activate a host response. So it can detect a minute changes that is taking place in the interdental area, and it can initiate a host response, thereby resulting initiating destruction, gingival inflammation initially in the interdental area, gradually progressing to the neighboring regions. So apart from the mechanical aids that has been widely used, the toothbrush is the most recommended plaque control agent. We need specific agents for the interdental areas. This is not just to remove the plaque and calculus from the interdental area, but also to maintain overall hygiene, both dental as well as periodontal. There are a number of factors influencing the selection of an interdental plaque control agent. The first one is type of gingival embrasure. So you should know about gingival embrasure. So what is a gingival embrasure? See this picture. You can see areas marked with green. Those are interdental areas apical to contact area. So we have spaces between teeth called interdental areas, and within this interdental areas, we have a portion of interproximal space or a proximal space that is above the contact point, and interproximal space that is below the contact point. That interdental space below the contact point, and that is normally filled with gingival tissue, is known as an interdental embrasure. These embrasure spaces are of different types. They have been classified into mainly three different types: type 1, 2, and 3. In type 1, gingival embrasure is when interdental papilla completely fills the space, completely fills the interdental space, or where there is only a minimal loss of interdental papilla. In type 2 gingival embrasure, there is partial loss of interdental papilla, whereas in type 3, you can see a total loss of interdental papilla. This is very well explained in this picture. Here this is a type 1 gingival embrasure. Here there is complete fill of interdental papilla in the embrasure space, whereas here in type 2, there is partial loss of interdental papilla. And in type 3, you can see total loss of interdental papilla from the embrasure space. Then, which are the other factors influencing selection of an interdental cleansing aid? The alignment of teeth, how teeth are aligned in an arch, the presence of orthodontic appliances, fixed prosthetic appliances, the presence of open spaces, open percussion areas, the presence of contact points as well as contact areas. So all these factors, they influence the selection of an interdental plaque control agent. So which are the interdental plaque control aids? We have dental floss as well as interdental brushes. So coming to dental floss. Dental floss, as you know, this is the most widely recommended interdental plaque control aid. They are of different types. Either they are monofilamented, they can be multifilament, they are bonded, they are available as bonded or non-bonded, they are available in different thicknesses, thick and thin. They are available as waxed as well as non-waxed dental floss. a number of factors influence the selection of dental floss. It should depend upon tightness of tooth contact, the roughness of proximal surfaces, as well as patient's dexterity. So, see, this is how a floss, dental floss, is placed into an embrasure space. Now, how now one should know the flossing technique, or how is flossing done in an interproximal space, how a floss can be used to maintain hygiene in an interproximal space. So for this, you have to take about 18 inches of dental floss and stretch it between both the hands using holding it between thumb as well as index finger. Or you can also use both thumbs, and you can use index finger to guide it into the interproximal space. This is how you guide a floss into interproximal space of maxillary teeth using thumb and index finger of both hands, whereas it should be directed downwards if we are placing it into an interdental space of lower teeth. Then the point that is to be noted while placing a floss into an interproximal space is that it should not be forcefully placed into the interproximal space, or we should not push it into the interproximal space. It can see here, you can see contact point. It can destroy this contact point or contact area. So one should gradually guide the floss in a zigzag motion into the contact, below the contact, into the embrasure space. It should gradually move into the space between the gingiva or the interdental papilla and the tooth. Once the floss is in place below the contact point, in between the embrasure space, or in between the interdental papilla and the proximal surface of a tooth, then it should be curved in a C shape like this. It should be curved like this. Then you have to move it gently beneath the gingiva, then slide the floss up and down with a slight pressure. Likewise, you have to floss each and every proximal surface, both mesial as well as of every tooth, beginning from the most posterior tooth of upper arch, then gradually continue till the distal surface of the same arch, then move to lower teeth. This is how flossing, this is how you adapt and place a floss in upper teeth. This is how it is placed in lower teeth. See, you can see it has been adapted in a C shape, then apply up and down motion. Nowadays, we have floss available with floss holders. So even patients lacking dexterity can readily use these floss with floss holders. Even powered flossing devices are also available, which are activated in a circular motion. Then we have fluoride coated floss are also available. So apart from removing plaque from the interdental area, they'll also help in remineralization. Thereby, anti-caries action has also been added with this fluoride coated floss. Look at this picture. Here, floss is being adapted into proximal surface of a premolar. What you can see here is a concavity present on the mesial surface of this premolar, and by flossing, we are not able to maintain or cleanse this concavity. So a dental floss is not recommended in such areas with proximal concavities. In such areas, we have to go for interdental brushes. So here comes the importance of interdental brushes. Interdental brushes, this is an interdental brush. So you can see this interdental brush has got multiple tufts. It is not a single tufted brush. It has got multiple tufts of bristles within this brush. So interdental brushes are either single tufted or multi-tufted. See, interdental brushes are available in different sizes, and they have even been color coded. So according to the size of interproximal space, we have to select this interdental brush. Now, how to use an interdental brush in an interproximal space? So we have to select, first of all, the selection of interdental brush size is important. So we have to select an interdental brush in such a way that it should be once we place an interdental brush into the interdental space, it should apply, it should be slightly, the size of the interdental brush should be slightly larger than the interdental space, so that the bristles apply sufficient amount of force onto the proximal surface of adjacent teeth. That is, it should apply sufficient force onto the mesial surface of in this case, into mesial surface of this premolar and to the distal surface of the other premolar. Once this brush is in place, then it is activated by back and forth motion. Interdental brush C, this it is inserted into an interdental space of posterior. Likewise, you can also use interdental brush onto the palatal aspect of upper posteriors. It can also be used in hard to reach areas in the lingual aspect of lower posteriors as well as palatal aspect of upper posteriors, apart from interdental spaces. This is another interdental brush. Here you can see, what you can see is a single tufted interdental brush. This has been found to be highly effective in maintaining hygiene over the gingival margins and lingual aspect of posteriors, lower posteriors, as well as palatal and distal aspect of upper posteriors. So a dental floss is indicated in type 1 embrasure spaces for maintaining hygiene in type 1 embrasures, whereas a multi-tufted interdental brush is generally indicated in gingival type 2 gingival embrasure space, whereas a uni-tufted brush is mainly indicated in type 3 gingival embrasure, where there is a complete loss of interdental papilla. Now we have another interdental plaque control agent, that is wooden toothpick. Wooden toothpicks, they are made of orange wood. They are mainly indicated for anteriors for maintenance of oral hygiene in the interdental areas of anteriors as well as premolars. Now let's see how toothpicks can be used for maintaining hygiene for plaque removal in the interdental area. A toothpick is inserted into the interdental embrasure space in such a way that the base of the triangle rests over the gingiva and the sides of the triangle are in contact with the proximal surface of adjacent teeth. Once the toothpick is in place in the interdental embrasure space, it is activated by back and forth motion. See, toothpicks are indicated only in open embrasure spaces and not to be used in type 1 gingival embrasures. Nowadays, even toothpicks mounted on handles are also available so that they can be used in inaccessible areas like in posteriors, in distal aspect of posteriors, upper, both in upper as well as in lower arch. Very similar to toothpicks are wooden tips. They are also triangular in cross section. They can also be used for maintenance of oral hygiene in the interdental embrasure spaces. So different interdental plaque control agents, dental floss, interdental brushes, which are either uni-tufted or multi-tufted brushes, then different types of toothpicks. So this makes it clear that maintenance of oral hygiene and plaque control in the interproximal areas are as important as maintenance of oral hygiene in other areas of oral cavity. So the purpose of interdental aids is not just to remove, is to remove plaque from interproximal areas and not to remove any kind of food lodged in between teeth. So that is about interdental plaque control aids. Their use is highly important in maintenance of oral hygiene, in maintenance of both dental as well as periodontal hygiene. So thank you.